Hello everyone, I'm Youngjin Lee, a medical school professor who has combined research and clinical practice for over 40 years. I'm board certified in both neurology and family medicine, and I work as an integrative clinician, bringing multiple fields together. My main area are aging therapy, natural product immunotherapy, and chronic pain treatment. Today's topic is a new approach that helps us maintain our health for as long as we live. Aging therapy. This is essential not only for you, but also for me. You've probably heard terms like anti-aging or slowing aging, but aging therapy may be new. Let me explain the historical background of this term. About 20 years ago, the focus was on the mechanisms of aging, what it really is, and roughly 5,000 papers were published per year. In the 2010s, theories that were once hypothetical became much more concrete. Lifespan extension in animals kept being replicated, and studies began to explore whether human aging could be moderated. Annual publication climbed to around 15,000. In the 2020s, aging has increasingly been viewed as a treatable pathological condition, and publications have surged to about 40,000 per year, at least 100 new studies every day. Our positive clinical report has continued to appear, and there are now about 1,200 ongoing clinical studies. In short, a new field has emerged, treating aging before treating disease. Taken together, current research suggests that even now there are practical ways to remain healthy well past 90, methods that anyone can put into practice. So, what exactly are we treating when we say aging therapy? It can still sound vague, so let's be specific. When disease develops and function declines, it's because at the cellular level, the capacity for recovery has reached its limit. Before that limit, however, science has identified around 10 key pathological processes. Cells undergoing these changes look and function differently from healthy cells. We define these as hallmarks of aging and make them targets for therapy. They include accumulated DNA damage, telomere shortening, buildup of senescent cells, impaired autophagy, epigenetic alteration, mitochondrial dysfunction, disrupted intercellular communication, immune senescence, and stem cell exhaustion, and gut microbiome imbalance. Importantly, these changes can arise independent of chronological age, driven by lifestyle and environmental factors, hence they are viewed as treatable. If we treat these cellular aging changes before disease appears, do we actually become healthier and live longer? There are 4 ways human lifespan has been extended. 1. Reduced early mortality. About a century ago, average life expectancy was 40 to 50 years. It rose into the 70s. 2. Preventing and treating chronic disease by delaying the onset of chronic illnesses with further reduced mortality. Thanks to this, the current average life expectancy is 80 to 81 years for men and 86 for women in Korea. But 2 programs have emerged. First, the pace of life expectancy gains is flattening. Second, many people spend the last 10 to 15 years of life in poor health, often from about 71 to 72 for men and 73 to 75 for women onward. Modern aging science aims to increase both health span and lifespan. This is the trend known as slowing down of aging or delayed aging, making aging itself the precursor to many diseases, the therapeutic target. In animal studies, when pathological cellular aging is induced, aging accelerates and lifespan shortens regardless of chronological age. Conversely, when those pathological processes are removed, the rate of aging slows and lifespan lengthens. For this reason, since the 2020s, research has moved decisively into the clinical realm. We are still early, but therapeutic interventions that modulate features of cellular aging has been associated with improvement in frailty and function. Based on current evidence, we cannot yet be certain that aging therapy will extend lifespan, but it clearly extends the healthy period of life, helping us remain active and happy longer. It is an innovative medical paradigm focused on quality of life. Finally, the fourth path to extend life is to rejuvenate old cells, often called aging reversal. This approach aims to revert molecular mark on our inherited DNA using genes or small molecules, what we call epigenetic cellular reprogramming. This has now reached the early stage of human clinical research. Many people ask whether there are prescription longevity pills available now. In animals, veterinarian prescribed longevity drugs are expected as soon as next year, but for humans, we are not there yet. Trials are ongoing. Notable candidates include the diabetes drug metformin and the mTOR inhibitor rapamycin. There's also interest in a replacing compound that decline with age, such as NAD+ and alpha-ketoglutarate, and in natural products like quercetin, quercetin, and resveratrol, which are being re-evaluated as aging rate modulators with emerging clinical reports. Other candidates on the study include GLP-1 agents, like those used for obesity and diabetes, and SGLT2 inhibitors, which promote urinary glucose excretion to see whether they activate longevity pathways or improve cellular aging. I believe within about 10 years, we may see prescription-grade longevity pills for humans. For now, many people take non-prescription natural products, and in my practice, I measure biological age while implementing them clinically. Although no longevity pill has yet been definitely proven effective, let me share several practices from early clinical research that have shown improvement in aging biomarkers and are doable by anyone. 1. Reduce DNA damage. Each cell incurs about 100,000 DNA regions per day. After our 20s, most are repaired, but by midlife, repair capacity drops to about 1/5. Unrepaired DNA accumulate, pushing cells toward cancer or senescence. Everyday culprits include UV exposure and fine particulate pollution, so sunscreen and mask matter. Among natural products, green tea stands out. Even a single cup can reduce DNA damage in blood cells by over 30% within 1 to 2 hours, and 2 cups daily for 3 months can increase DNA repair capacity by over 50%. 2. Protect telomeres. Telomeres cap our chromosomes. At first, in leukocyte, average length is about 1,700 repeat cells. They shorten with each cell division, about 500 cells by our 30s, and about half by our 70s. Below 500 cells, cells remain alive but stop dividing, they become senescent. Among natural compounds, cycloostragenol and stacrose saponins have shown the strongest telomere support signal. In studies taking it for 6 months, telomere length increased by about 5 to 8%. 3. Clear senescent cells. When DNA damage accumulates or telomeres become very short, cells detect this and enter senescence, a survival strategy that prevents malignant transformation. Senescent cells send inflammatory signals to summon immune cells for clearance, but with immune senescence, clearance cannot keep up. Senescent cells accumulate and accelerate aging. Thus, immune aging and senescent cells burden are tightly linked. A natural candidate with reported senolytic activity is quercetin, a flavonoid abundant in onions, apples, and strawberries. Many other agents are being actively studied. Within a decade, we may see a dedicated senolytic pill. 4. Activate autophagy. When senescence or damaged components builds up, cells can degrade and recycle down through autophagy, an ability conserved across all life for survival. Among current longevity practice, caloric moderation is the most robust activator of autophagy. If autophagy is genetically disrupted in animals, caloric restriction no longer extends lifespan. Foods that strongly promote autophagy include broccoli sprout, fermented food, and pomegranate. Notable natural compounds are urolithin A and spermidine. Large clinical trials of metformin and rapamycin are also underway, and enhancing autophagy is one of their key mechanisms. To close, let me highlight the most important and essential ways to improve cellular aging and extend health span. For preventing chronic disease and reducing mortality, the fundamentals remain. Eat well, sleep well, move well, manage stress, don't smoke, drink moderately, and maintain a healthy weight. The same applies to aging therapy, but with different emphasis. 1. Exercise. Beyond the standard slight out-of-breath aerobic work plus strength and balance training, for cellular aging you can, if feasible, extend total daily activity from 30 minutes up to 2 hours, incorporate high-intensity intervals, and perform large amplitude resistance movement within safe joint ranges. For example, for quadriceps works, flex and extend the knee as far as is safely possible. This provides stronger stimuli and more pronounced improvement in aging markers. At the same time, avoid overreaching. Increase intensity and frequency judiciously, and resume only after proper recovery. 2. Nutrition. Emphasize caloric moderation and intermittent fasting. For example, 16 to 8 time restrict eating, 5 to 2 intermittent energy restriction, 5 usual days, 2 low caloric days of approximately 500 to 600 kilocalories, or a 24-hour fast once a week where appropriate. 3. Combine all health habits. When practiced together, studies suggest Healthspan can extend by at least 10 years, and in some reports by up to 24 years. In Korea's 2021 data, 1 in 3 adults have hypertension. Among those 60 plus, it's 1 in 2. Among those 70 plus, 2 in 3. If you ride the subway or bus, 1 out of every 3 nearby adults likely has high blood pressure. Yet treatment usually starts after a formal diagnosis of hypertension or diabetes. Neither disease appears overnight. Cellular abnormalities accumulate silently for years until they cross a threshold. By actively managing aging at the cellular stage, we could shift from 1 in 3 adults having hypertension to 1 in 10 or even 1 in 100. Extending health span this way is the wisest choice for preserving quality of life and dignity, and it's the only power that let us lead our lives as ourselves right up to the very end.